Everyone, good morning.
Good morning.
It is 9:31, so I'd like to call to order the HHS meeting for August 17th. Roll call, please.
Chair Renahan. Here. Vice Chair Swartz.
Here.
Member Solomon. Here. Member Chaplin. Here. Member Desart. Here. And Member LaPlante.
Here. Great, thank you. Do we have any public comment?
No public comment.
Great. So we have a lot to get to today. And most importantly here, by way of announcement, PADS has asked for a few minutes to speak to our committee. And what they are going to tell us is going to be big news in DuPage County, I think. So I ask at this juncture for our committee to limit participation to listening. We will have time for questions as we move forward. And I think any questions can be taken offline to our executive director, April Redzik, and she's also here today with Patrick Scar. So I'd like to welcome them and please come up and give us your big announcement.
Great, thanks very much. I have a handout because we love handouts. Thank you.
Good.
Good to see you.
Thank you. Yep.
Thank you.
Thank you.
Good morning. Thank you.
Thank you.
Good morning, Chair Renahan and members of the committee. Thank you for the opportunity to be here and all of your service to our county. I'm April Redzik. I'm President and CEO of DuPage PADS. I'm so excited to be here today to briefly share some news that will transform our organization, enhance the social safety net, help break the cycle of homelessness, and empower families and individuals toward independence on their journey toward a safe home of their own. Last week at the Finance Committee, you were briefed that there's a once-in-a-century opportunity to leverage federal funds to help PADS buy and repurpose a property to open an interim housing center. Based on consensus last week, we've moved forward in our due diligence and are pleased to announce we've reached an agreement in principle to buy a 130-room hotel at 1113 Butterfield Road in Downers Grove. Shortly, we'll submit our full application to the county, but given our decades of partnership together, we wanted to visit with you all first. COVID-19 has created unprecedented need in our community and forced PADS to meet its mission differently. In partnership with the county, we rose above great challenges to provide a hotel model of interim housing because it was the safest option to keep our clients safe and the entire community safe. Thanks to funding you provided over the past 18 months, we've saved 430 individuals, including 130 children, from being forced to live without a secure room of their own, kept them safe what could have been catastrophic health consequences at the height of a global pandemic. Without a doubt, our partnership saved lives and reduced the spread, but equally important, we began to observe transformations in our clients who are residing in interim housing. Compared to our historic operations, providing clients with a private, secure room to temporarily house themselves has resulted in an 80% reduction in mental health incidents compared to what we would see in congregate shelter. We've also observed a 75% decrease in spread of health conditions, such as flu, influenza, respiratory illnesses, and other physical health issues. Equally stunning, we've had a 500% increase in the utilization of case support services. Clients who in our old model were using site locations to go from one location, had to travel during the day, and then go to another location, began using our case management during the day and got closer to financial independence. They spent that time looking for jobs, taking care of a health condition, doing other critical things that would help end their homelessness. During COVID, our mantra, and one that was supported in so many ways by this wonderful county, was that we would not stand idly by, that we would be as agile and creative as we needed to be so people had a safe place to turn and so no child would have to sleep in a car. I want to repeat that because I think it's so important. Because of all of you here, because of your tremendous support, in DuPage County, we did not leave a single family without resources during COVID. Here in DuPage County, since the fall, no child has had to sleep in a car. When they came to PADS, they had a safe room with a door, a healthy dinner, a private place to shower and brush their teeth, a warm bed, breakfast, and a way to get to school in the morning. Given where we are today, we don't believe that we should go backward. Making a one-time investment in the social service infrastructure of the county will help ensure that in a county as blessed as ours, our goal for the past 18 months that no child will have to live out of a car with their family can be a permanent goal. In the coming weeks and months, we're going to do our part to continue to connect with you, the Village of Downers Grove, our partners in the faith communities and volunteers to make this plan a reality. DuPage PAD's 130-room interim housing center would be a permanent expansion of our collective capabilities. PADS will continue to prioritize rooms for families with children, individuals with mobility issues, and those who are fleeing domestic violence, which is another area we're seeing shortage in shelter right now. Our new interim housing center is not going to be an intake point. That will continue to happen at our client service center. It's also not intended to provide clients with long-term accommodations. There are other resources and programs that already provide that assistance. Instead, the facility fills a gap and provides individuals and children with dignity, security, privacy, and certainty before a more stable and appropriate housing option can be secured. The interim housing center will facilitate better outcomes for clients at a lower overall social and economic cost, while improving the quality of life for families in need of a helping hand. I'm here today to ask that you partner together with us, PADS, to disrupt the cycle of homelessness and empower individuals to reclaim independence, economic attainment, and a stable future after losing the safety of their own homes. On behalf of PADS and the families we serve, I'm so grateful for your past support and ask for your backing of this exciting initiative. Thank you for your time. We will be in touch. And Chair Redhen, thank you for your time this morning.
Thank you. I will stick to my own rules here, not ask any questions or make any comments, but thank you so much. I mean, this big news is not enough, right? So, all right. Thank you again for being here. So with that, I will ask for approval of the minutes of August 3rd, 2021. Any questions, comments? All in favor?
Hi. Can I get an agenda, please? I grabbed the wrong one.
Any opposed to the minutes?
We have two.
That's okay. Those are approved. I will take a motion to approve FAR 38421 resolution acceptance and appropriation of the Illinois Department of Health Care and Family Services Access and Supplementation Grant 6,000. Chaplain, do I have a second? All in favor?
Aye.
Any opposed? All right, motion passes. Take a motion on FIR 38521, acceptance appropriation, Illinois Department of Human Services Emergency Solutions Grant, PY 22, 50,663. Second, anybody? Second. Colin? Questions, comments? All in favor?
Aye.
Any opposed? That passes. Take a motion on FIR 38621, acceptance appropriation to Illinois Home Weatherization Assistance, $346,142.
So moved.
Second. Chaplain Solomon, questions, comments, all in favor?
Aye.
Any opposed? That is passed. Take a motion on FIR 38721, Aging Case Coordination Unit Fund, $5,919,000.
So moved.
Second. Questions, comments, all in favor?
Aye.
Thank you. Take a motion on FIR 38821, additional funding for the ILD CEO Community Services Block Grant PY 21, $178,983. Second. Questions, comments, all in favor?
Aye.
Any opposed? That passes. Take a motion on FIR 38921, additional funding for the 47th CDBG FY 21, increasing to $57,065.
So moved.
Second. Questions, comments? All in favor?
Aye.
Any opposed? That passes. I'll take a motion on FIR 39321, acceptance of DuPage County Community Development Commission agreement with the Care Center for the South Wing Room window replacement and for the water heater, $800,000. Solomon, sorry. Questions, comments? All in favor?
Aye.
Any opposed? That passes. Question to staff on 7A. Is this staying?
We're moving forward with it. There's still a possibility it'll get pulled next week.
Okay.
Yeah, there's the organization is having tremendous challenges with their contractor being non-responsive. So we're trying to figure out if there's a way that we can either remove that particular element and do something different with these funds, cancel the contract altogether, or provide an additional extension.
So are we pulling this today then?
We're not pulling it today.
We're not pulling it.
We're telling the organization that we'll move forward with it today, but because it has to go to the full board, we've still got a week to figure out what exactly, if we are going to extend this or not.
Okay. Yeah, should we put it, let's put the question out there and then speak to it. I had been notified I was maybe gonna have to pull it, that's all. All right, I'll take a motion to approve HHSR 39021, approval of third modification CDBG for kids above all, formerly known as child service. All right, so we have a second. All right,
Okay,
Member Sullivan.
Thank you. Do we have any input in who contractors are, or they pick their own contractors for their project?
Right, so the way it works is that we provide an agreement, we oversee their bid documents because they do have to go through a formal procurement process. And then, but the agreement is between the organization and their contractor. We have no, we are not a party to the agreement, so we really don't have any opportunity to influence.
So if, for example, that, let's say this contractor, they never contacted, we got to move on or whatever, is there a way to say we won't allow CSBG funds to go to project that contractor is working on so that we don't have another folks?
Technically, no. The only way that you can deny them is if they're debarred.
Okay.
There could, I'm not exactly how that debarment process works. I don't know if William knows, but you know, that if I think debarment is, there has to be some sort of fraud,
Yeah.
you know, negligence, those kinds of things. So no, not necessarily.
Okay, thank you.
Any other questions or comments on this item? All right, all in favor, say aye.
Aye.
Any opposed? That passes. I'll take a motion, HHSR 39121, CDBG, cancellation of services with Prairie State Legal and reprogramming $13,037.25 in funds. All right, questions or comments? Ms. Hart?
Thank you, Chair. I did have questions about this one. Why does it seem that Prairie State Legal can never spend all of their resources? It's just frustrating with all the evictions and things coming up. They can't seem to.
That's not the case here.
Okay.
This is a case of the way homelessness is defined in the CDBG. They're not able to document properly. We are using different funds. So it's just a matter of, yeah, it just didn't work with, HUD came up with sort of a new definition of homelessness specifically to these funds. It doesn't match the way Prairie State is. I think it's because I believe there's a property inspection required if you do it with CDBG, and obviously Prairie State attorneys are not out there inspecting the property.
Right, right.
We
So
are
there is
funding-
a different tranche of money for the eviction.
Yes.
Okay,
Yes.
thank you so much, Mary.
Mhm.
Is it, Mary, aren't we about 400,000 deep with Prairie State for the eviction still?
I'm not sure what you mean by deep.
I think
How
that's
much
what
we're
we had
providing
allocated.
them? Yeah, off the top of my head, I don't know what we're providing them. I know we're providing them substantial CARES Act money from either CDBG or ESG. I
It
think
seems like
it-
every year they're giving us the money back, not being able to use it.
You know, there's been, we have to cancel both an ESG and a CDBG contract with Prairie State, so that's why it feels like that. There was an issue with CSBG funds. Again, it had to do with documentation. It wasn't necessarily that they are, you know, they're certainly providing a vital service. The difficulty is on the income documentation and the processes that are required with some of these federal funds.
Any other discussion? All right, all in favor?
Aye.
Any opposed? That passes. Take motion on HHSR 39221. This is a cancellation of CDBG agreement, DuPage County and Midwest Shelter for Homeless
So
Veterans,
moved.
reprogramming $245,700. I'm sorry, who was the first? Thank you. Questions, comments? All right, all in favor?
Aye.
Any opposed? That passes. Moving on to the Care Center. Take a motion to combine items 8A, 1, 2, and 3.
So moved.
All in favor?
Aye.
All right, I'll take a motion to approve FMP 33121, City of Wheaton Water Utility, October 1st, 2021 through September 30th, 2025, not to exceed $2,870,000 for the Care Center. Also to approve FMP 33221, Wheaton Sanitary District for the Care Center, 4 years, October 1st, 2021 through September 30th, 2025, not to exceed $1,850,000. And 2021-70, approval of Cronus for software support services, time and attendance system, and knowledge pass for DuPage Care Center, September 28th, 2021 through September 27th, 2022, not to exceed $23,083.78.
Second.
Okay, good. I'm deaf in my left
No,
ear,
I
I'm
was
sorry.
trying to speak up, I'm sorry.
All in favor, say aye.
Aye.
Any opposed? All right, that passes. All right, I'll take a motion to approve 2021-71, recommendation for approval of AccuSheet LLC for the health screening visitor management kiosk for the DuPage Care Center, August
So moved.
18, 2021 through August 17, 2022, not to exceed $15,574. We have a second, yes. I had a question on this. Is this COVID related? Do we know?
This is Janelle. Yes, that would be. It will alleviate us having staff members to do these functions.
Okay.
So yes, it's part of our screening requirements for COVID.
It sounds like a good one. All right,
I agree.
all in favor, say
Aye.
aye.
That's a
roll call. Oh, I'm sorry, that's a roll call.
So do these come out of our COVID funds? I'm sorry. COVID funds, do these come out of our care, our.
Well, I guess that was ultimately my,
Yeah.
it's COVID related. It should be.
Just so I could speak to that too. We're in the middle of analyzing anything from the second half of 21 and into 22 that would be COVID. We did track very carefully through March 3rd and provided that information to finance. And now we've been asked to go back to March 3rd forward. So we did continue to track many items, but those are all being tracked right now for that very issue to see if it can go under COVID dollars.
All right, great question. All right, roll call, please.
Member Schwarzy,
Aye.
Member Solomon,
Aye.
Member Chaplin,
Aye.
Member Desart,
Aye.
Member LaPlante,
Aye.
Chair Renahan.
Aye. That passes. Take a motion on budget transfer for supplemental staffing for pharmacy department for the care center, covering interim coverage for pharmacists, 75,000.
So moved.
Second.
Questions, comments? Member Solomon.
I know this was due to a staff member leaving. Are we recruiting for this position or is that not posted yet?
It has been posted, and last I was aware, we have 4 candidates, so we're very optimistic.
Thank you.
All right, great. Any other conversation on this item? All in favor?
Aye.
Any opposed? That is approved. We've got a couple travel authorizations for overnight travel. I'll take a motion on HMIS manager to go to Atlanta, Georgia, October 11, 2021 to October 15, 2021. $2,165. Right, we have a motion, we have a second. We have a question.
I think sadly, we're getting back to wondering if travel will get canceled. I just wanted to make sure for this one, if in October it's not safe for someone to travel, we'll be able to get all the dollars back.
All right, any other questions?
I just want to say that I appreciate that they're both grant funded. I think that's important.
All right, excellent. Any other questions, comments? All in favor?
Aye.
Any opposed? That passes. Someone, we have. What's my page here? Nice. Thank you. We have an almost identical request at authorization for overnight travel, senior community development specialist to attend also Atlanta, Georgia, October 10, 2021, October 15, 2021. Much cheaper rate of $2,000.23. All right, questions, comments? All in favor?
Aye.
All right, that is passed. I'll take a motion to approve consent items 11A through M. So moved. All right. Questions?
Second.
Questions, comments? All in favor?
Aye.
Any opposed? That passes. All right, moving on to residency waivers. We do have one. Everybody should have a sheet here.
I'll make a motion to approve this residency waiver.
Thank you, Member Stark. We have a second.
Second it.
Questions, comments on this waiver? Janelle, is there anything you wanted to add here?
Actually, Anita's going to speak to that. She has that information with her.
Okay, great.
Can everyone hear me?
Yes.
Yes, thank you. Good morning. We currently have 5 male and 12 female beds available at the care center. 6 beds have already been offered to DuPage County residents. There are no DuPage County residents being displaced by this particular applicant, who is a 97-year-old female, has never lived in DuPage County, but has immediate family that has lived in Wheaton for over 9 years, and they are her power of attorney. They've been visiting regularly until the change in COVID restrictions, and they plan to restart visiting once restrictions are lifted. In their letter, they've appealed and has told us that the center has provided her with peace of mind and the fact that her loved one is being well cared for. Thus, they are seeking the residency waiver for admission to the care center.
Okay, well, that sounds like a pretty good endorsement. Any other questions, comments from the committee on this one? All right, we have a motion, we have a second. All in favor?
Aye.
Any opposed? That's approved. And with that, I will turn it over to the DuPage Care Center. We have Janelle and I think Anita, you're both going to work together on the 2022 budget request.
Yes, thank you everyone for allowing us to present our 2022 budget submission. I will preface my presentation by saying I was in a car accident. So I'm recovering. So if I fumble on my words, I have my team there to back me up. So thank you for your patience if I tend to have some word finding challenges. So I'm going to jump right in. So this is a presentation for 2022, and I'm going to direct you to slide 2. So this is an overall presentation of our revenues and expense budget roll-up. You can see that we do present a break-even budget, which has been an expectation for the care center from the beginning. I'll walk through these revenue projections and expense. And some of these you may have questions, but we probably will address it further down in our PowerPoint, but certainly you can raise them now as well. You can see from our patient care, we are projecting a 34 million. Non-patient care would be things like cleaning other areas of the campus or the cafeterias. We're looking at 1.7. We have our indirects at 2.6. We have the CDBG federal grant in here at 2.2, which I'm going to speak to more. We have the county subsidy in at 2 million. For many of you are newer board members. The last 2 budget periods, we've had a county subsidy of 2 million. We used to have a county subsidy of 3 million. And then we have funds on hand at 1.5. So we had, I'll speak to this further as well, but with our occupancy challenges in 2020 and 2021, COVID has really restricted our admissions for the majority of that time period, meaning we were not able to admit based on outbreak status. So our census obviously dropped through attrition over time. And so we dropped about, and I'll get into that later, about 22%. But so we had a gap between revenues and expenses. And so that gap is being covered by the funds on hand or our fund balance. So then I'm going to go on to expenses, and there are different categories. We'll talk a little bit more in detail of these, but personnel being our largest is about 25.6 million, and then commodities, contractual, and capital make up the other expenses, and we'll break those down a little further. And then the next slide will reference you. We provided you 2 documents, spreadsheets that breaks out the line items for our revenues and expenses. So I refer you to that. Even after today, if you have questions, we certainly can provide you the full 30-page document. The care center is very large, many different line items. So any questions so far? Okay.
Go ahead.
Thank you. I'm going to direct you to slide 4. We're going to break down the revenues a little bit further. So I talk again about the care center revenues were significantly impacted by the inability to admit. So we've dropped in occupancy by 22% or 71 beds. I would tell you that the industry from COVID, the industry impact of admissions has been about anywhere from 40 to 70% in some buildings. So our 22% represents 71 beds, which is significant, but we're very pleased with our COVID performance that we limited that risk to 22%. Our revenues for 2022 will reflect a partial recovery of occupancy, meaning we're planning to recover. Our budget for 21 was 94%. We lowered our expectation to recover at 90%. This will be a stretch goal for the care center, assuming no additional restricted admissions for long periods of time, and that we must be able to rehire so that must be able to increase hiring so we're able to care for increased residents. Our revenues by payer for 22 are altered from 21. We anticipate more Medicaid and Medicare placements and less private pay and less insurance placements. we're just seeing more Medicaid people, less people with private pay funds, which is an industry standard. So we had to shift our expectations for the different type of payers. Our rates, which I'll break down further, are varied. So we anticipate higher rates of reimbursement per day for Medicare and private pay and Medicaid. But our rates will be flat for insurance. And I mentioned this earlier, but the subsidy remains at 2 million, which is equal to less than 4.5% of the total operating budget for the care center. Slide 5 shows you our breakdown. It's always very important that we show that the mission of the county is to care for the vulnerable and the indigent. And so our public aid percentage, we've always wanted to keep it at about 70% or higher. This year for 2022 budget, we're anticipating to go admit more public aid and less private pay, as I mentioned earlier. Oftentimes people who come in under public aid will have some private pay funds and they go into what's called a spend down status. So maybe they have a year of funds left and so they would be private pay and then convert over to public aid while being in the facility. So there is that component that could also raise private pay, not just direct admissions of private pay. Slide 6 shows you our per diems. This is our reimbursement. It's based on many factors. Our public aid reimbursement is based on a nursing component, a capital component. So there's multiple things that drive that rate, our timeliness of MDS submissions, things like that. So that's a robust rate. We're happy to have that and to see that continue to go up. That's a reflection of many, many different things within the care center. Private pay per diem is at a 4% increase of private pay. That will go to the board for approval once our budget is accepted. We always make sure the board approves a private pay rate increase, and the industry standards anywhere from 3 to 5% over the last couple of years. As I said earlier, the insurance per diem, we're expecting that to stay flat, and then our Medicare per diem, we're expecting that to go up to the $721.79. With that, I also will reference you to the expense sheet handouts. I think there's multiple pages that you were given because there's very many line items with the care center. Before I jump into expenses, is there any questions?
No questions.
Thank you. So I'm going to say that the overall expenses for 2022 show an increase of 4.6% as compared to the 21 budget. I will explain what that is. It's specifically one or two items that are driving that, and I will show that to you. Also, when you look at our 21 anticipated, like where are we expecting to end 21 fiscal year 21 compared to 22 budget, you will see an increase in expenses for 22. So you might ask, why are you expecting a higher budget when you're anticipating to run lower? And the portion of the 2022 budget is that whole recovery of residents and increase in staff. So the 2022 budget has to reflect those things under the expense. Personnel for 2022 is down 4% from 21 budget. Again, however, our current personnel run rate is significantly lower than our 21 budget. So that the 2022 budget, as I said earlier, reflects an increase in personnel related to an anticipated completion of the union contract and our ability to hire with competitive rates. The 22 health insurance reflects an assumption of a 4% increase over annualized 21. This was the guidance from finance. Commodities, they're expected to decrease by 1.4%. Again, that is reflected in, we're budgeting a lower occupancy than we budgeted in 21. You can see on slide 9, the utilities, we're expecting them to decrease over 4% over 21 budget. And then this last bullet is to explain why we were up in expenses by 4.6%. So in previous years, when we received money from CDBG or we put in for grants, for example, the windows, if the project was going to be 800,000, but we were going to get 400,000 from CDBG, we budgeted 400,000, the difference, which that's been that way since I started, which it's really not an accurate way to budget, because you got to have the full expense dollars available to you for the entire project and not just the difference. So this year with CBDG grants coming in at 2.2 million, we budgeted that as an expense of 2.2 and also as a revenue of 2.2. So it makes it appear as though the expenses are that much higher when in actuality, we're just changed the way we budgeted for CDBG. Does that make sense?
Yes.
Okay. Does anybody have any questions?
All right, what questions for the committee? Do we have any? All right, Janelle, great job. We're showing no questions from the committee. I don't know if you, oh,
I have
do
a
you have
question, not on the budget, but on her update, so I can wait.
I'm sure. Go ahead, Member Solomon. I guess we do have one. All right.
Janelle, thanks so much for your budget presentation. If I heard you correctly at the beginning, I think you said we're back to some COVID restrictions at the care center, which I don't
We
think is
are.
surprising to any of us, and I think we're mostly just surprised it took this long. So
Yes.
congratulations on that. Can you just give us a brief update of what the visiting?
I can. And I'll share some information that occurred over the weekend. It's a long story and I'll try and be brief. Last week, and I'm not going to remember the exact dates, we had an employee get tested. I think it was Friday, August 6th. He was tested and was negative. He works within the kitchen. Over the weekend, wasn't quite feeling right. Hadn't been to work since that Friday. And that Tuesday, went and got tested, was positive. So because his symptoms presented within 48 hours of his being in the building, and I believe it was very close, like the 48th hour, we still have to go into outbreak status. So we had to do a whole round of testing of residents and staff. So on Thursday, we tested about 200 mix of residents and staff. Thursday evening, about 8:30 in the night, we started getting those results from Northwestern Lab. Those results came in, we had about 30 positive within an hour. And mind you, that's when we freak out. So it just didn't seem right to me. And we've questioned our results from our labs in the spring on 3 different occasions. And by us pushing back and having them rerun those, they ended up being negative. So we don't always just assume that the labs are correct. We know that there's issues with calibration. The type and size of the swab can vary things. So Annabelle, my director of nursing, has always been taking a strong stance. I mean, this is very impactful for us. So she fought back and said, this doesn't seem right. Of all of those, I think 2 were unvaccinated. The rest were vaccinated. No one was symptomatic of that 30. But by the end of the night, we actually had 60 positive out of 200, according to this. So when we inquired with that, the labs, they said that they switched over to a molecular type testing or a different platform of molecular testing. And we were fairly new in their implementation of this platform, which also didn't read well. We said, could you please run them on the prior platform? And the quality control person agreed, ran 4, and 4 came back negative. So that raised a lot of questions for us. And we went on to like 2:30 in the morning. So even though we questioned the results, we still have to act. So we moved over 20 residents in the middle of that night down to the COVID unit. Thank God we had expanded the COVID unit just in case. So that was all ready. The staff, night shift is the slimmest staffing you can have. And the leadership team went in and they moved 20 people into the COVID unit because we have to presume they're positive. So we did all of that. We put the units on quarantine. We continued to fight the results, working all the way up with a molecular scientist, and kept pushing and pushing. I won't get into all the details because they're long back and forth, but they ended up doing 3 different rounds of tests on retesting on those same 60 staff and residents. And by the 3rd round, everybody was negative. So you can imagine that pretty much decimated our building because 1, you had to put everybody back on lockdown. We had to call everybody's families and tell them. We had to move everybody. Staff were freaking out. We had 40 staff members that couldn't work. We had staff members that went and got a hotel room because they didn't want to expose their families. So the impact was huge. And so we're all still trying to recover from that. So we got the negative results, and then I want to say Sunday or Saturday, we had another staff member that hadn't been at work, but still in that same scenario, tested positive outside. So one is much better than 60. So we do have a unit on quarantine. We are considered an outbreak status, and we'll be conducting yesterday and today a whole nother round of tests of all the staff and residents. So there it is in a nutshell.
So a nice relaxing weekend.
It was terrible, absolutely terrible.
Yeah, well,
But the
thank you
team-
and your staff for. your
Yeah,
hard
I think
work.
the staff, I can tell you, even through our annual survey, the staff have just been awesome. So,
Member Shorzy?
Oh, I'm sorry. I had a-
Oh,
sorry,
no follow-up.
go ahead, Member
So
Summer.
for, if, I might be getting care center and sheriff's office confused, so correct me. But didn't we just do a contract with Northwestern for medical care? That was it the sheriff?
That was the sheriff.
Okay, 'cause I guess I'm frustrated that lab procedures would change and give us a whole bunch of expenses and staff expenses. And I'm just wondering what's the
Right.
consequences for that?
right,
Yeah, or
so
can we
in
use a
the,
different vendor if they're not trustworthy?
they're not gonna charge us for the tests.
Oh, that's nice.
But so I've been involved with Julie, was involved with these discussions. Obviously Cheryl and Nick have been very involved with me in these discussions, and I've also been working with one of my colleagues who is the regional director of IDPH for our area. And I've been sent him the timeline and information as well, and he was going to discuss this with his chief, I forget his title, down in Springfield. But it begs the question, not just this lab, but any lab, all of them are switching over to some of these molecular tests. And the theory is that it detects trace amounts. And if you don't, this is what we were told by a scientist, if you don't acknowledge that as a positive, in a matter of days, like he said, 3 days, I believe, you're going to have massive outbreaks. Well, how do you say 60 people had the same date of exposure and are at the same level, of that viral load in their body? And wouldn't they all have full-blown COVID symptoms in a staggered pattern versus everybody at the exact same time, which, by the way, they haven't. So this whole concept of this molecular testing platform, there are more than one apparently. So I think it raises questions about COVID testing, not just at this lab, but throughout. So they're looking at it as a broad, how many others? There's facilities in our market that have rampant cases. Are they accurate? I don't know. It's not just this lab potentially. Could be the platforms.
Thank you so much. I wonder if as a follow-up, we could see if ARPA funds could be provided for grants for staff that have to make that decision to not go home.
We're on it, but yeah, point well taken.
Thank you.
Vice Chair
Thank you
Shorzy?
all for your support.
Don't go anywhere yet, Janelle.
All right.
So I'm sorry, I'm circling back to the budget because it took me a little bit of
You
time
bet.
to kind of process some of this stuff. But going to your spreadsheet, your budget spreadsheet, at the very top, it has regular salaries, your adopted 21 budget and your 22 budget.
Yep.
What are the number of employees that were in the budget 21 adopted and what we're looking for in 22? Because I see that salary is decreased by a minimal amount, but I'm just curious on how many staffing people we are looking at. And then what we ended up actually spending, which was, $4 million less than what was budgeted.
Right. That's where we anticipate. Obviously, that's because of we're really in a challenge for hiring right now because our rates, remember, have been frozen because of the union negotiations. So all of that is contingent upon our ability to hire the 22 budget. The actual numbers that represents, I'm not sure I can answer that. I don't know if Ken or Anita can answer the actual numbers of staff. I
don't think we can look back and get you actual specifics, but we don't have the actual number of staff that it impacts right now.
Okay, so I guess what I'm curious about is is budget 22, does that bring us, is the number of employees that you would like to hire and have here, does that equal what it was in 21, or is that more or less? And then my only other question was salary, wage, and adjustments. You have a item of $66,000. Is that for the assumption that the contract will be settled and that will be the increase, or is that something else?
That is something else.
Okay, so,
Is Nick Kopmeyer in the room?
no.
I am on,
Hi, Nick.
hello.
So two questions then. One is, does the regular salaries, does that include the assumption that the contract will be settled, and what percentage increase does that include? And then what would that salary and wage adjustments, what would that include on the line item?
So from the standpoint of the contract negotiations, obviously the team is doing everything they can to settle those negotiations, and we will incorporate, once we have a handle on it, which is probably the next 2 to 3 weeks, exactly what that final number will be. We will incorporate that into the final 2022 budget. We don't have a final handle on that right now, but it will be in the budget before you guys have it in front of you in September.
So these numbers might change a little bit.
Absolutely. We will modify that with finance and Janelle's team to incorporate where we're going to go with that contract.
Okay. And then, so Janelle, then that line item that says salary, wage, and adjustments, I mean, it's a small amount at $67,000, but it's a big increase over what was in last year's budget. So what is that?
Well, I believe that 66,000 represents a potential 2% COLA. We always budget that in preparation if it would be approved by the board. So it's a placeholder for a COLA.
Okay, that's all. Thank you.
When talking with Janelle, it's Jeff.
Hi, Jeff.
We put a significant amount of money in the budget for retro pay for the ESME contract, I thought, so.
Correct. The retro pay is in there. The final salary amounts are yet to be determined, and they'll have to be modified as we move forward. So it's very much a work in progress, and unfortunately, the timing wise of negotiations, didn't allow us to incorporate everything fully, but it will be in the budget you see before the chairman's final approved budget.
It's just not in here, but it's in the September.
There are portions of it in there. There are portions of like the retro pay, things like that we're confident will be in there, but it's not the final refined amount.
Okay.
Subject to contract.
Thank you very much.
All right, great. Any other questions for Janelle? All right. I just want to say thank you. COVID challenges day to day and cumulatively have not been small. So I appreciate your leadership and the care that we give over there over at the care center and all the work that's put in with the finance on this budget so far. And I'm calling Mary Keating now.
I'll make it really quick. I have 3 quick things I just wanted to mention. First, one of the things that April didn't discuss was the really positive and productive conversations they've had with the Village of Downers Grove. Now that you know the location, in fact, they just gave me a letter from the Village of Downers Grove that they got yesterday indicating that the village will not require any kind of zoning changes for the property. It'll be able to be operated as is, so they don't have that barrier. She said that when she spoke to both the village manager and the village president, both were enthusiastically supportive. And you don't recognize the address, it's the Red Roof Inn on the south side of Butterfield. Then 2 other things. I want to thank the entire board, and particularly Health and Human Services, for the support that I received in my ARPA request. So there's 2 follow-ups from last week that you'll hopefully see coming to finance next week. The first is, as Nick discussed, we are looking at salary increases for our entire information and referral and case management groups. A good portion of that will be covered by grants, but a portion does need to be covered by general funds, specifically those increases associated with senior services, because that's our largest group, and it also funding that we get from the state and federal government really isn't adequate to absorb those increases. But it impacts a total of 74 positions. So that will be hopefully HR has everything, finance has everything. It should be on placing names next week. Or actually, I think it's a separate resolution than placing names when it's a large thing like that. And then the other ARPA follow-up, I'm hoping to bring the headcount resolution to create those 4 positions that I requested. So there will be a headcount resolution increasing our staff by 4. That would be using the existing titles. That would be 3 case managers and 1 communication specialist. So that's where we are with that.
All right, any questions for Mary? Thank you very much. All right, do we have any old business? Do you have any new business? All right, I will entertain a motion to adjourn.
So moved.
Second.
All right, all in favor?
Aye.
All right, we are adjourned until September 7th.
Need the president's.
Okay, I'll-
Oh, yeah.
Read my notes.